Hi, I'm Dr. Rahman, and one of the things I get asked about is PCOS. PCOS stands for Polycystic Ovarian Syndrome. And from the gynecological perspective, usually that presents with a woman who comes in saying that she has irregular periods. And by that usually means that she can go months at a time without having a menstrual cycle. And she comes in, and there are 3 criteria that are usually used in order to make the determination of polycystic ovarian syndrome. One is irregular cycles. The other is elevated testosterone levels. And the third is polycystic appearing ovaries on ultrasound. Now, to be a little clear, when you do an ultrasound and you look at the ovaries, you may see, depending on where she is on her cycle, egg follicles starting to mature. And if it's prior to ovulation, you might even see the dominant follicle from which the egg is going to be released. But that's not what a polycystic ovary looks like. A polycystic ovary tends to be larger than normal and has a lot of tiny little follicular cysts around the cortex. And so that appearance will alert the radiologist that this is a polycystic appearing ovary. And that, along with the other criteria, is used to make the determination of whether or not she has polycystic ovarian syndrome. Now, again, from the gynecologic perspective, if she has irregular periods, so the next thing I want to know are 2 things. Are you trying to get pregnant? And or are you trying to regulate your cycle? Meaning that you don't want this hit and miss. I'm never quite sure when I'm going to start to bleed. I want to have a predictable cycle, just like my girlfriends. And so if the option is I want to get pregnant, I need to explain that it's harder for a woman to get pregnant with polycystic ovaries because she doesn't ovulate on a regular basis. She ovulates on an irregular basis. And so because she ovulates irregularly, it's harder for her to get pregnant. Whereas the woman that ovulates every month about the same time knows that she should have sexual activity around the time of ovulation. So if she's not ovulating on a regular basis, but she wants to get pregnant, then there is medication available to her to help her to ovulate more frequently. And prior to medication, often we have seen that the loss of 10 to 20 pounds often almost resets things, and she will start to ovulate just with weight loss. The other scenario is, no, she is not trying to get pregnant, but she does want to have regular periods. And one of the easiest ways to do that is to give birth control pills. Now, you need to understand that birth control pills do not solve the problem. They do not eradicate polycystic ovarian syndrome. It just gives you, through hormonal manipulation, a regular monthly bleed so that you don't have excessive, annoying bleeding. It's predictable, and your life becomes a little more simple.
Okay, I know a friend of mine that was diagnosed with PCOS. She also experiences like the overgrowth of hair. And I don't know if she just had poor providers, but she was very frustrated that her only options were either birth control or to lose weight. And she is like, clinically a bit overweight, but nothing, too severe. So it was a bit frustrating for her around the time of her diagnosis, because it's just like, well, yeah, and I think she also had poor reactions to birth control in the past. So it was kind of like, I don't know what
and that's true. There are some women who can't or just don't want to take hormones. And there are other options. There are other medications. One of the things associated with polycystic ovaries is increased testosterone, and the way that becomes evident when you look at a female, she may have acne, she may have hair growth, she may have enlargement of her clitoris. All of this
Hirsutism? How do you say it? Hirsutism? Okay, yeah.
That's right.
I know what it is.
That's
I just don't know how
right.
to say it.
Increased hair growth, acne, increased size in her clitoris, all as a result of increased testosterone. So it's a relative hormone imbalance, and what birth control pills do is manipulate the hormones, and that's what it is, manipulation, so that we can give her a regular bleed. But it does not solve the problem. If the other issue with PCOS, it can put her at an increased risk for something that we call metabolic syndrome, which means that you're at an increased risk for systemic things like hypertension and diabetes. And there's medication that's not hormonal that's sometimes given, like metformin, or there are other medications that are available for her to use, but usually the choice will come down to one or two things. Either some sort of medication, and there are lots of different categories of medications, and not all of them are hormonal, or lifestyle change. And that's a hard one to accept sometimes. I mean, it's not necessarily a quick fix, but either it's going to be some sort of medication, it doesn't necessarily have to be hormonal, or it's going to be a lifestyle change. And I think that's pretty much true with any health condition or history that we deal with. I mean, it comes down to, are we willing to make a lifestyle change, or do we prefer to take medication? And on a personal note, I will say that I had to make that decision because I have a family history of high blood pressure. Okay. Just about everyone in my family, parents, sibling, have high blood pressure. So that's kind of the reason why family history is important. If it runs in the family and you're in the family, you may be at risk for whatever this is. So I'm thinking I'm at risk for hypertension. And I noticed over time when I would check my blood pressure that it was starting to go up, particularly if I felt stressed or fatigued or tired. And I started to see this upward trend to the point where I thought, oh, I might need medication. And like so many people, I didn't want to take medication. I did not like the idea of having to take a pill or multiple pills every day to control my blood pressure. And so I wanted to see if I made dietary changes, could I bring my blood pressure down? And I'm happy to say that the answer is yes. I mean, I haven't always enjoyed the process, and sometimes I truly miss not eating like I have in the past, or drinking like I have in the past, but I see the benefit, and it comes down to which would you rather?